July was Fibroid Awareness Month, and with a diagnosis of the health condition can come all sorts of questions.
That's why Dr. Marguerite Brathwaite is here to discuss the condition that's developed during women's reproductive years. Good morning.
Hey, how you guys doing? Good to see you.
Yeah, good to see you too.
Good to have you back. So what are uterine fibroids and who do they really affect?
Well, uterine fibroids are like benign tumors that grow from the smooth muscle of the uterus, and they can grow into big tumors, and they can cause symptoms, to women of reproductive ages. You see them mostly between 30 and 40s, but some of the younger women can get uterine fibroids as well.
Right. So we have some pretty graphic pictures to show everyone at home. So what are the common signs and symptoms of uterine fibroids?
You can get irregular bleeding, pelvic pain, pelvic pressure. You can have pain with bowel movements. You can have pain with intercourse. So it depends on how big the fibroids can grow. And sometimes some people are asymptomatic and don't even know that they have fibroids.
Right. So I was going to say, so it can basically affect every aspect of life.
Right.
Laying down can be uncomfortable, standing up can be uncomfortable.
Yeah.
It can affect everything.
Everything, and then you can bleed a lot and become anemic and need multiple transfusions or iron transfusions, and you can get very tired from anemia that you might not know because your periods may be very heavy, so it can affect all of that.
And a lot of these symptoms, there's a lot of conditions that sort of mimic these symptoms, so how is this diagnosed?
When you see your gynecologist, if they do a pelvic exam, they can feel a mass, and they may ask for an ultrasound to confirm whether or not they're feeling uterine fibroids. And uterine fibroids can coexist with other conditions like endometriosis. You'll find it often, and that's when the lining of the uterus goes on the outside of the uterus and the implants in the pelvis. And then you can have also adenomyosis, and that's when the lining of the uterus invades the muscle of the uterus and causes pelvic pain. So sometimes those conditions also can coexist with fibroids and cause a lot of concern.
Yeah. What are the treatment options available to women out there for uterine fibroids?
If the fibroids aren't that bad and they're just having symptoms like irregular bleeding, they may try to control their bleeding with, birth control pills to try to have regular cycles. But if it starts becoming a real issue, they may have to look into more significant options like uterine artery embolization, which they can put the radiologist can put little particles inside the vessels that supply the uterus and block the blood flow to the fibroids so that they can shrink or decrease. Sometimes, if they're really big, some people may give them a shot of Lupron, which is a medication that can suppress the ovaries and decrease the estrogen in your body. Fibroids are considered thought of as being estrogen dependent. So when you get into menopause age, that when your estrogen lowers, that sometimes the fibroids may shrink and not bother you. So Lupron kind of puts you in like a menopause state and shrinks the fibroids, but it's only temporary because you can only get it for 3 months, and then by 6 months they can come back. So people may use Lupron just to decrease the bleeding before they have surgery or to help with their anemia. And then you can do surgical treatments, which would be like minimally invasive surgery. We use the robot. We can do robotic-assisted myomectomies and just remove the fibroids, or robotic-assisted hysterectomies and take the uterus totally out so that you don't have to deal with it anymore, depending on size and circumstance. And with the robotic minimally invasive surgery, no hospital stay, you go home right after. Improvement, recovery time is faster and quicker. Yeah.
Now, who are the ideal candidates for these procedures? Because obviously it's ranging, I'm sure, case by case. Sometimes it's more severe, not so severe. So what does that look like for person to person?
I think the biggest issue when it comes to fibroids is, besides anemia, is fertility. Do you still want to have babies? So that's going to dictate a lot of how you decide your treatment's going to be. If you're not caring about conceiving, then you may want to go ahead with a myomectomy or a hysterectomy, or uterine artery embolization. But when you still desire fertility, that's when it becomes an issue. And so small fibroids you don't have to do anything about, they're benign tumors. Only when they become symptomatic, you may have to intervene. And so if you still desire to conceive, then you may want to maybe consider a myomectomy or just treating the fibroids symptomatically.
Well, Dr. Brathwaite, thank you so much as ever.
Yes.
Full of information, knowledge, and I'm sure you've helped a number of viewers out there, and certainly they need to come and see you, get checked out first so they can make a determination. on
Exactly.
treatment. Thank you so much, guys. For more information on Dr. Brathwaite's practice and to set up your next appointment, visit innovativewomenscare.com, and her office is located on West Sahara.